Good evening, friends. I'm Dr. Sanjay Kalra, your friendly and familiar endocrinologist, and you're watching Dr. KK's Med Talks. Now, do you know that men hold up half the sky and perhaps more? Without men, we wouldn't survive. But yet, when you talk of medicine, people will talk of women's health, children's health, adolescent health. Men's health is often ignored. Can't men have problems? Can't men have complaints, concerns, challenges? Of course they can. And when we talk about complaints, concerns, we talk about health. So, can men not have problems or challenges related to their health, related to the intimate parts of their health? Of course, they can. How do you understand these problems and then how do you manage them? For that, you need an intimate, a very inside view of what men's health is, what sexual health is. So allow me on today's KK Med Talks to welcome one of the best teachers in the country. A warm welcome to Professor Dr. Deepak Jumani. Dr. Jumani is a professor and he runs the only fellowship program, the accredited fellowship program on sexual health in the entire country. And perhaps a warm welcome, Professor.
Thank you very much, sir. Thank you.
So we have people logged in from across the country, physicians, non-physicians, men, women, everyone who's interested in knowing more about the intimate parts of health. And there's a namaskar for you from Ramji Agarwal Saab. And the question is, sir, what made you interested in this field?
That's really interesting, which got interest towards this most important part of the quality of life of human beings. Thing is that I was a physician, and usual people used to call me for conferences to give lectures. So in one of the lectures, when I was giving my oration, Dr. Prakash Kothari, who's a big name in sexual health, and he was the pioneer who brought the Kama Sutra to the world map. He was running an OPD in KEM. He spotted me and he said, "Deepak, you leave your general this thing and you come in me. You are a cutoff for my joint, cutoff for my this thing." This was way back in 1999 or something like that. Okay. So then he called me in his OPD. I went there. I was listening to the stories of the patient. Every story was so touchy, so gruesome, and they were so helpless. I saw patients who were about to break up, and they were going to divorce, and marriages would be shattered, families would be shattered. And for many of the cases, I found they were just myths and misunderstandings, you know about the size of the penis, about bath, and so many things. They had all wrong concepts ingrained in their mind. And then I felt, okay, these people need to be told what is right, what is wrong, and what is normal, what is abnormal. And and I had a good passion to listen to patients, and I was told that I counsel very well. So I thought that this could be really a good branch for me, because all said and done today, what helps is education to the patients. See, if a 3-year-old child is sitting on the ground and a snake passes by, he will hold the snake. He does not know that this snake, if I catch, might bite me and I'll die because of the poison. But you and I will do it because we are educated. So what I felt is this field, which has been a taboo for ages, I don't know why it is, though we are all born out of it, but still we don't talk about it. So this particular branch, I got fascinated by the fact that we can make a difference in everybody's life who has these issues. Then, when I went deep into this, I realized that if I look at the spectrum of patients having sexual dysfunctions, he could be a diabetic, he could be hypertensive, he could be dyslipidemic, obese, smoker, alcoholic, stressed, under certain drugs, under certain skin diseases, lung diseases, liver diseases. So, I mean, I felt that the scope of problems with these issues is huge. And then I said, yes, I would go in for it. And I was with him for 10 years till he retired from KEM. And then I joined JJ Hospital as an assistant professor, and I'm still there. This is my story.
Thank you so much. And that's a very important story. So basically, myths and misconceptions about manlyhood, about masculinity, these are there. And Dr. Jumani was able to identify an unmet need, and a very major need for that matter. And as this need was not being met earlier, that would lead to marital disharmony, to marital breakup, to things like divorce, and even, sir, you'll agree with me, attempts to commit suicide as well.
Absolutely, absolutely. Yes, yes. They're
Now,
so disheartened. They're so disheartened. A man, if he's not able to perform, he feels like there is, or even if he gets an early ejaculation, which is normal, which anybody can get. It's one of the most commonest problem which all men have sometime or the other in their life. If he has a little bit of early ejaculation, he feels that somebody has hit him on his head, like a brick, and he gets shattered completely, and he feels that his manhood is gone completely. And then he certain wrong stories in the advertisements or papers by quacks, etc. And he gets, he completely gets totally disturbed. I mean, he loses his confidence, esteem, and then he's worried, he's anxious, he's concentrating on his work, and so many things follow after that.
so it leads to psychological dysfunction, psychiatric dysfunction, and also social dysfunction. And of
Absolutely.
course, the family dysfunction, of course, is there. Sir, Shiban Kothaji thanks you for all the good work that you're doing. Ramji Agarwal points out we need to talk about beta blockers, so we'll come to that shortly. But then what we are getting is that this is an unmet need, that is one thing. And secondly, this need is being fulfilled by non educated people or by misinformed people. People misinformed themselves. And that is why that's a double whammy. So the man who has an intimate problem, first of all, he is not able to access the right specialist. Secondly, he ends up accessing or interacting with the wrong person who gives him wrong information or mis or disinformation, and that worsens things. So let's try to set things straight today, sir. KKMA Talks, people from across India and beyond logged in listening to you. And sir, a question coming across from the audience is, what does the word health mean to you? So many nations, but what does it mean to you personally, to your heart?
um, Health is what your body is. I mean, how it is functioning, how you walk, how you feel. So let's talk about sexual health, which is a definition of it is that it is, of course, related to sexual well-being, how your physical, emotional, mental, social, you know health pertains to that. It is not that it means that you should not have any disease means you are healthy. No, it's not that. It's that you should be able to be sexual without any fear, without any guilt, without any shame, without any compulsion, without any inhibitions, etc. That's what is the real sexual health body. It should be only for just feeling good, pleasurable, being joyful. So if all those things are there, and if it is possible for you to be feel all these things, then you are sexually healthy, and that's what sexual health means.
So health means you've used the word being joyful, being happy, being contented, being
Yes.
satisfied. These are
Yes.
different synonyms that we have. And from a sexual perspective, then, sir, what is the aim of sexuality in life? You've said health, reproduction. Do these go hand in hand? Are they different? Rupender Tiwari says this definition of health is very sexual health, what you've said. Would you like to expound upon it?
Okay. See, sex is what you do, and sexuality is what you are. See, it describes your orientations, your identity, your choices, your behaviors, etc. So that's the difference between sex and sexuality. Now, anybody could have any type of orientation. A crime. See, I don't see a gay as a criminal, or as a different, or as something wrong, or a bad person, or a sinner, or anything like that. He's also a human being. He's got all anatomical organs same as us, but he's not congruent with his own self. So be transgender, so sexuality is how you behave towards the act of sex. How what are your feelings? How do you act upon it? But sex is the real act, what you do. This is what is the difference between sex and sexuality.
Right. So thank you, sir. So now we are moving into a broader domain of sexual health, and we are talking about sexual orientation as well. So let's park this heterosexuality, bisexuality, homosexuality. Let's park this for the later part of the talk show. Uh, how important is sexual health for a sense of well-being? Supposing I have got a 56-inch chest, I have got sixer abs, I can lift 100 kg. I win a gold medal in the Olympics, and I also win a gold medal in my university exams. Is that enough for a sense of well-being, or will sexuality be required? Have you come across any patients in Ropide in the last week or so? Maybe someone very well accomplished with lots and lots of achievements, but the only issue was sexual ill health, and that gave him a feeling of worthlessness.
See, we must understand we are all born out of it. We are not fallen from the tree. Okay. So, according to me, sex is our body's normal, natural function, like passing urine, passing stools, eating food, breathing, heartbeats. These are all normal and natural functions. Having sex also is normal and natural function of our life. If it was not normal and natural, we and you and I would not have been here. Okay. So it's normal and natural to have sex. I call it, it is a quality of life. A good sexual health is a good quality of life, but it's a part of quality. We are all born out of it, but we should not get stuck to it. That should be there. It's God made. Inhibitions, restrictions are human made. And there has to be certain. I call sexuality and spirituality to be exactly the same. Because when you think of spirituality, say like to a temple. You know, what you see in a temple, you see an idol which is well decorated and all that. There is fragrance, so your visual senses are taken care of. Your sense of smell is, there are bells which ring, so your hearing sense. And then you touch something and you get some prasad, so you taste. So all those senses which are involved when you see something spiritual also are involved when you are having a good enough sex. It is similar, but today this has been drifted and made a lot of wrong things have been happening in the behavior, which is sometimes torn and a completely shattered thing. So I call this as an illustration of God, and it's a part of quality of life, but a very important part of quality of life. Because if you are sexually happy, you develop a good connection with your partner. There's good bond. It has been seen there is growth, and it is also a very important aspect for your confidence, for your own well-being, and it makes your life having a meaningful encounter in life. That's what is important. And 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 that's what is all about it. You need satisfaction, you need confidence to grow, to do your daily activities. And because today we are bombarded with so many movies and books and internet and all, full of all. In fact, we all are living in a sex saturated society, and we have got all wrong, but still we would like to be healthier. We would also like to be sexually active. And being sexually active, see, when you understand the pathophysiology of any sexual dysfunction, say take it child dysfunction, it's nothing but the endothelial dysfunctions. Now, when does the endothelium gets buggered up? It gets buggered up only when you have slightest rise in sugars, when you have slightest rise in pressure, or slightest rise in cholesterol or fatty things. So these are all the things which are non-communicable, but these are all killers. So if you are having a good endothelium, and if you are able to have good enough sex, you have a longevity factor in you. You are living a healthier life. That's why, according to me, scientifically, if you look at it, if you are able to have good enough sex, you are healthier. You can live longer. You're going to live, it's not in your hands, it's all destined. But you're going to live a healthy and a valueful life. So that's what is important. That's why sexual health is very important.
So, multiple things coming across from what Professor Jumani is teaching us. Let's paraphrase them. Good evening to Dr. Yogesh Uplenchwar ji as well, and Aradhina Zakat Saab. Sir, Dr. Sachin from Mumbai one of the industry leaders in the medical industry field, he paraphrases what you've just said. Dr. Sachin says, am I right if I say that sexuality is a component of good? It is a contributor to good health, and it is also a consequence of good health. All three things put together.
You can club it. You can have have anything like this. Okay, I call a good sexual health equate to a good health or a well-being.
So it's a
Completely.
component of good health.
Yes,
Yes.
because if you are able to have sex, Sanjay, your everything is fine. Your coronaries are clean. That's what it is. So the major cause of your death, which is cardiovascular, is not going to be there. That's the
Yeah.
crux of
So,
it. We need to understand that.
so I see Dr. Sachin smiling. So component of overall health, a consequence of overall health, a contributor to overall health, and also an equivalent of coronary health. If you have good sexual health, it means your vascular health is good. Dr. Mithilesh Tripathi and Krishna Shawji thanking you. The other thing you pointed out, sir, for us was the multi-dimensional aspects of sexuality. It's not just about touch. All the five sensations that you have, your vision, your hearing, your touch, your taste, your smell, all these contribute to the sexual. And we have with us a young dynamic man from Haryana, Aditya Panu, who has logged in. He says, good evening to you. And he says, I am 18 years old and I understand this paradox of plenty. The paradox of plenty is that in the earlier generations, there was no exposure to sexual education. Now there is too much of exposure to sexuality, sexual education, images, pornography. And instead of improving things, that's actually worsening things because you're not able to find out the right thing and you're not able to understand the basic aim of the sexual act, which is happiness and contentment. So, first of all, Dr. Jumani talked to us about the various C's, the component, consequence, the causality, and also the fact that it's a health equivalent. Sexual health is coronary health equivalent. He's then talked to us about uh, the multiple sensations or the multiple sense organs being involved in good sexuality. The paradox of plenty, Pannu Sahab has pointed out, and so have Dr. Jumani. And then, sir, you talked about the endothelium, that good sexual health means that you have good blood vessels, and that actually is a marker of longevity, of long life. Let's carry on, sir, and let's try to break this down. Vinayamaji greets you. And this is what are the phases of sexual response? Do you have something like that? Or is it just in half a minute? I am reminded of this Punjabi song, sir, from Bhag Milkha Bhag. And he says, slow motion Angreja. This is Milkha Singh in the movie. Slow motion Angreja, sarsari kyun badhaye? So he talks to the foreigner. Why are you kind of building up that that anticipation? Why are you just indulging in foreplay? Why don't you go and do the real thing? So what is the phases of sexual response, and sir, what is foreplay important for?
Okay. Um, so I'll start with the phases. Every endeavor, even if you make a building, has to have a foundation. Okay. Then you build floors. So even in the sexual response, according to the stalwarts in the field of sexual medicine, uh, Virginia Johnson and Masters, what they found out is that the basic thing is the desire. That's the foundation. Once you have a desire, it leads to arousal, which is erection. Okay, this leads to orgasm, or ejaculation, whatever. So the first phase is desire, second is arousal, third is orgasm, or you can call it ejaculation and orgasm, and then the whole thing comes back to normal. It's called a resolution. We have added another aspect to it. It's ultimately satisfaction in the end. It is the phase, the when you think of phase, it's the desire leads to arousal. That's the second phase. Orgasm or ejaculation is the third phase, and resolution is the fourth phase, and then the satisfaction. These are the phases of male sexual response. Now, coming to your point of foreplay, a very interesting review by John Bancroft. What did he say is that if you take a total sexual act, you know, say it's lasting for 10 minutes, suppose it's lasting for 10 minutes. What he said that these 10 minutes involve three phases. First is the foreplay, second is the interplay or the intercourse, and the last one is the afterplay. Now, we men are mono-orgasmic. We get one erection, one ejaculation, and that's it. Then there's a refractory period, which can be 10 minutes, half 1 hour, 1 week, maybe as much as it. But women at one given point of time, they get multiple lubrications to the tune of around 8 to 10. So this is the difference between the male and the female. Now, when you talk about foreplay, interplay, and afterplay, the foreplay is an act which you do or activities or whatever you do till you penetrate. Okay. Then once you penetrate, you thrust till you ejaculate inside. That's the interplay. There's a third very important aspect of this intercourse is the afterplay, which men don't understand, which I'll come to later on. Now, when you think of foreplay, according to me, the foreplay of a man begins at the end of his last intercourse. Foreplay is nothing but exciting your partner, exciting your own self by anything, by romance, by touch, by compliments, or by, all using all your senses, maybe your tongue, maybe your vision, maybe your touch, or whatever. So it is doing everything to excite your partner. Okay. The duration, suppose if it is 10 minutes of an intercourse, the foreplay should be 60%. 60% of your time of your act should be foreplay. Then once you are excited, you go and penetrate. This penetration in and out till you ejaculate should be 15% of your time. That is 1.5 minutes. Or maybe a little more. And the rest should be afterplay. 25% should be afterplay. Why is this so? See, what happens is, we men get aroused as fast as possible. Women take a little more time to get aroused. They need more of, arousal things like touching, kissing, licking, all those things. So foreplay has to be little. And when you do foreplay, you get aroused, you get erections, but a woman can get only 1 or 2 lubrications, may not be more. And then when you have intercourse, you ejaculate, you finish things, but a woman gets another 1 or 2 lubrications. So out of the 8 or 10, she's got only 4 lubrications. 4 are still remaining. So these remaining 4 lubrications or remaining part of whatever arousal is gets over when you do a good, adequate afterplay. Now, what is afterplay? Afterplay is once a man ejaculates, you should hold the partner tight, hug, thank her, compliment her, tell her she was beautiful, she was awesome, she did a wonderful job, and do everything what he did during foreplay again. See, she's not completely orgasmic, but in this afterplay, he ejaculates. If he does all these things for 25% of the time, she has the rest of the lubrications. And when you compliment her, when you thank her, what is the signal you are giving it to her? If you look at a girl who's good looking, did lot of makeover, anybody would say, oh, she's gorgeous, she's fantastic, she's superb. But if you compliment your partner in the bedroom after you have ejaculated in that state, you are giving her a signal that you like her the way she is. And that speaks miles. And that is an incentive for her to give her more excitement, give her more pleasure, give her everything what your partner needs. So this is what is the importance of afterplay, which men don't do. Men ejaculate, turn themselves on the other side and sleep. They use their partners as sleeping pill, which is wrong. And that is why most of the women today lead an unsatisfactory sexual life. So this is the importance of foreplay, inter and afterplay.
So, sir, things that we are learning for you. First of all, sexuality or the sexual act, it's not an individual act. Of course, unless you are indulging in masturbation, it's an act of 2 people. And both people's health is important. And a simple thing like a compliment, that goes a long way in ensuring a better experience the next time. Sir, there's a salam for you from Dr. Noor Aga Danish from Kabul in Afghanistan. He greets you. Muhammad Shafi Ansari Saab sending you a good evening, and Anita Drilani Madam also greeting you. So we've learned the phases of the sexual response, not only foreplay, interplay, but also the afterplay. And then we've understood the difference between men and women. So men will get aroused early, and then they want to discharge early. Women will get aroused
They
slowly.
say men are like matchsticks and women are like iron.
Yeah, so it takes time. So, sir, let's go on to more discussion. Now, we understand the physiology, but supposing there's an illness, my question is it a poor self-esteem or poor self-image man which can lead to sexual dysfunction, or is it the other way around? And supposing someone gets it into in his head that my penis is too small, what kind of impact will that have on health?
This Dr. Sanjay happens when they try to compare. Today they watch porn. Now in porn, the penises are fabricated. Suppose the penis porn star has is about 5 inches. They have a mold which is of 8 inches above that. Okay, this is what I got the edition from a very big porn star. So what he showed me how they camouflage the rubber penis over his penis. So we need to make our penis talk, understand what is it. How I manage these issues with the length is very, very simple. And believe me, all have gone so satisfied with their mind. I asked them one question: what are the functions of the penis? So they say urination. I said, okay. So if urination is the function, how much length do you need to pass urine? I said, kitna bhi hoga chalta hai. Then I asked them, what is the other function? They say, other function is to have sex. Then I explained to them the female anatomy of the vagina, where the penis enters. So science has told us that the outer one third of the vagina, see, vagina is 6 inches maximum. The outer one third, which is 2 inches, have got all the nerves, nerve endings, G spot, etc. in the outer one third, 2 inches. Beyond that, there are hardly any sensations. So I tell them that if you take a lighted cigarette and put it inside in the entrance and at about 3 inches or 4 inches, she will not even win because this is totally anesthetic. So if at all your penis in an erect state is 6 inches, completely goes inside, which is the part of the penis which is giving her the pleasure? They say this 2 inches. Then I say, okay, if your penis is 4 inches in erect state, which is the part which is giving her all the sensation? Says 2 inches. So according to science, if the length of the penis is 2 inches and above, it's normal. Now, then I tell them, look, your nose is bigger and my nose is, am I smelling less? Your ears are small, my ears are big. Am I hearing more? So, any organ of our body, any anatomical part, if it is giving its function properly, it's normal. And then I tell them, Amitabh Bachchan is 7 foot, a very good actor. Amir Khan is 4.5 feet. Is he a bad actor? So it's not the height, it's not the length, strength what is important. We need to counsel them and explain to them all these things, then they forget. It's only when they compare themselves with somebody, either they watch somebody while they pass urine, or they watch on the in the movies, or some people boast about it, all that. So length is not important, it's the strength what is important. If a man has an erect penis which is more than 2 inches, little bit more than 2, he is normal. He can pass urine, he can have good enough sex. That's not. These are. He does not have any third function.
And we have a comment from Bachon Ki Pathshala, which in English means the school of children. And this is, thank you, sir, for explaining in such simple words. Now we understand and we can help our friends and colleagues gain more confidence. Alpesh Sangadia ji thanking you for your excellent explanation. A greeting from Dr. Anil Pathak as well. So let's carry on, sir, with the phases of life, phases of the sexual act. And the first subject that you mentioned, or the first phase you mentioned, was desire. Can we have any desire disorders? What are the disorders? Why do they occur? How do you pick out what's going on? And if possible, how do we treat a desire disorder?
See, desire can be low or can be high. Okay, I call it desire discrepancies. Okay, partners having more desire, he having less desire. But in let's talk about male first. So we will not talk about female. Male is our main concern today. Male sexual desire or interest is upon, if you think medically, psychologically, there can be many reasons. Wife having extramarital affairs, wife having all medical problems, wife nagging about it, and all that. So those things don't come in low desire of a man. But a man really having low desire has one common condition in the population is low testosterone. We call it hypogonadism. So if that is less, he has all the symptoms where he has less interest, less sexual thoughts, doesn't get good enough erections, he gets tired very soon. And there are signs and symptoms of low testosterone, which we can see. He has got less hair, he's got gynecomastia, and so many things, So all those things can give us an idea as to that this person is having low desire. Now, of course, you need to be very cautious when you treat it. Today, we are seeing gyms open in every lane of our city, and the gym instructors are giving youngsters testosterone. मैं तेरे को सलमान बनाता हूँ. So they are pumping in testosterone, growth hormones, androlone, steroids, etc., and they're making bulk. But they are forgetting one thing, that in doing so, they are harming them by, decreasing their sperm count, making them, sterile. So this is one bad thing. Again, testosterone, we can't give it to elderly people because we have a fear of they getting prostate cancer or heart failures, etc. So we need to treat this meticulously, of course, with the help of a very good endocrinologist like Dr. Sanjay. We need to take his guidance. We need to ask him as to, there are other investigations to be done, whether it is primary, secondary, tertiary, all the other tests can be done. And then also prostate specific antigen can be done, and see if he's likely to get any other complications later on in his life. If there are no complications in his life, all the reports are normal, then we can give them these hormones accordingly. There are injectables, there are gels, there are tablets, there are patches, so we can treat these things very easily. But of course, monitoring is very, very important, and diagnosing as to whether it's primary cause or whether it's secondary cause or the tertiary cause. So we need to diagnose that properly by doing SHLH and all the other tests, and of course seeing that we don't harm him by giving him something like prostate cancer later on in his life. So we need to monitor, and this is how we can take care of the desire part of it. Now, why testosterone? One important thing which I have learned in my practice is that we find diabetics having erectile dysfunction. Okay, now all these diabetics also have low testosterone, they're all hypogonads. So until and I find diabetologists writing Tadalafil 5 mg, take it for a long time, you'll feel better. It doesn't help them. So the reason being, studies have shown, research shows that until you raise the testosterone levels in these patients to a certain level, your PD5 inhibitors, be it Tadalafil, Sildenafil, will not work. So we need to see that we need to bring that thing at a certain level. Okay, why? Because studies also show that testosterone not only is important for semen and sperms, etc., but also very important for the integrity of the penis, the health of Nica albuginea, the smooth muscles, the trabeculae. All those things are also equally important to be taken care of, and this is taken care of by testosterone. If those things are not proper, your erections will not be. So this is all desire.
Sir, point well taken, and greetings for you from Salamat ji, Manjeet Kumar ji. Hemant Sharma Sahab says that, like you rightfully said, the three common endocrine causes of loss of libido, that means loss of desire, would be low testosterone, high prolactin. Prolactin occurs in both men and women, and high TSH. But usually the most important one is testosterone. And like you've mentioned, we need a basic critical mass or a critical level of testosterone. Sir, you mentioned diabetes, and then Hemant Sharma Sahib says it's like a cobweb. It's not linear causality correlation. It's a cobweb, multiple things contributing. So he has two specific questions for you. Sir, the role of obesity. I have a borderline testosterone. I am a little bit obese. Did obesity cause my low testosterone? The other way around, what do I do? And then his second question is, sir, many of us work in multinationals. The stress that we go through, only we know. So stress and testosterone. When you come back, let us say in Mumbai or Bangalore from a busy day at work, and then you say I have no libido, is that or no desire? Is that normal, or does it mean I have a disease?
Well, about obesity, we need to understand. We have evidences that when the adipose tissue increases in size beyond its capacity, there's something called as aromatase which increases. So when this increases, reduces the testosterone in his body. So he has low libido, less desire, less erections, less everything, what is required in the bedroom. So if you want to make him sexually active, you don't have to replace testosterone or supplement testosterone in these patients. We need to counsel them. We need to give them such horrible counseling and counseling that he should reduce his weight. If he reduces his weight, his aromatase levels will become different and his endogenous testosterone will become normal. We are finding obesity in young patients. We can't give them testosterone. You need to counsel them that, okay, Baba, tumhara vazan kam karo. So that is what is very important. But we are finding doctors writing Sustanon 250 milligram alternate days for days. Nonsense. I've got prescriptions from endocrinologists, sir. I've got pictures. I don't want to name those, but this is what is being practiced. So this is not. Even if we don't want to give them testosterone. We have Tenport from Himalaya, beautiful, also giving equal good results. Nothing wrong in that. Can give our patients all that. So we have alternatives to somebody who's averse to allopathic medicines. We've got a lot of beautiful to give, which are body compliant, holistic, and safer also. And patients will be very happy to take it, because when we started our medicine, we took an oath: primum non nocere. First, do no harm. I don't want to harm my patient by even increasing his PSA. I don't want to do that. So let me be safe. Okay, he is got a tendency to high PSA. I would give him something alternative to that. So this is what is.
Yeah, you're actually right. You mentioned the word Tentex Fort. That is a proprietary preparation, which actually improves desire and will not cause either increase in testosterone or increase in estrogen. What happens in a person who is relatively obese? When you take testosterone, that enters the fat cells, the adipose cells. In the adipose cells, you have a hormone called aromatase, and aromatase breaks down the testosterone into estrogen. So, in physics, there's a difference between speed and velocity. And we have Sharma ji with us, who is with his child learning class 10 physics. So speed means you do everything in a hurry. Testosterone, one or two shots may give you a good impact initially. But velocity means in a particular direction, continuous, continued. In the long run, you will end up getting more estrogen if you don't lose your weight. So the first step, like Professor Jumani said, is to control your diabetes, improve your stress levels. And Dr. Shashi Khare, K.S. Singh ji also adding to that first question. Sir, what about stress? How does stress act on the brain? How does it change the hormones? So a person with the borderline testosterone, okay, testosterone, how can stress tip the balance towards ill health? And then how can stress management, sleep hygiene, help us improve our sexual health?
Very, very, very important. Very, very important. We all are stressed somehow or the other, like small children. Now we all know stress produces cortisol. So cortisol is doing all the damage. Okay. I talk to my patients, what is the stress you have? This, that, make him little lighter by sharing whatever he has. Then I also treat this in a little different way, not medically, but this is what I do. I tell them, देख यार, जो होने वाला है होके रहेगा. तू और मैं एक झाड़ का पत्ता नहीं हिला सकते. Can you do that? No. Whatever has to happen will happen. It's destined to happen. All you got to learn, whatever is going to happen, is accept and adapt. Very simple thing. Accept it and adapt to the new thing. Try and do this. Don't get stressed. Stress is just anxiety. You are increasing your cortisol, you are increasing your other things, and you're making yourself more worst. You're spoiling your present also, all these things. So these people need little bit of counseling in a different way. And these patients do come out of it. It's this. Then I give them an example कि मैं यहाँ से अगर बाहर जाता हूँ, मुझे किसी बस ने उड़ा दिया, मेरे पैरों में बहुत सारे फ्रैक्चर्स हो गए, आई विल नॉट क्रिब अबाउट इट. ठीक है यार, ये फ्रैक्चर्स 2-3 महीने में 6 महीने में ठीक हो जाएगा, यहाँ लगता तो मैं क्या करता. So think it in a different way, make it more positive. This had to happen. It was destined. Now it has happened. I can't rewind the time and go back and see that the bus is coming and I go back. I can't do that. It's happened. So I accept it and adapt to the new thing. यार ये ठीक हो जाएगा 2 महीने में. So that way you make them feel, because otherwise they would start, somebody, if he goes to a psychiatrist, he'll give him anti-anxiety drugs, antidepressant, that'll make more worse things. So we need to give a little bit of time to our patients, be emphatic, explain to them in a very legitimate way, in a very logical way and factual way. I'm not telling him anything wrong. I'm giving him the facts, educate him to understand and be more courageous in life, to accept everything. That's the key to removing all the stress in life.
And speaking to many of our colleagues who have joined in, Manjeet Kumar ji, Harpreet Kaur madam, Manoj Kumar Tripathi sahab, Imtiaz Pathan sahab, this is part of life. No river will flow the same way continuously. There will always be ups and downs. So if you have a down, there will always be an up after that. Dr. Jumani sir, this is one very nice thing about Indic cosmology. When you look at Western cosmology, for example, Christianity, then there's a cosmology. So today we are in the world, then tomorrow there will be revelation, there will be judgment day, and then everybody will go to heaven. But when you look at the Jain religion or the Hindu religion, everything works in yugs, in cycles. And basically what the cosmology says is, there will be good times and there will be bad times, but they reassure you that the bad times are shorter than the good times. So that's what we are learning from Dr. Jumani.
Also, when you look at an ECG, Sanjay, if it's a straight line, means you are dead.
Yeah.
If there's something going on up and down, you are alive at least.
So these emotions are there. Sir, two questions. One is coming from Sonipat in Haryana, and the other question again from Haryana. Sir, I am an unmarried boy. Masturbation healthy? Sir, I am a married man. I enjoy masturbation. Is that healthy? Questions coming from people at different people in different phases of their life.
See, masturbation is nothing but self-gratification. It's a necessary evil, you can call it. So it's normal. One, it's healthy, it's beneficial. These three things are with masturbation. If a person tells me I have never masturbated, there are two causes. One, he's telling a lie. Second, he doesn't have a penis. There cannot be any third reason. So masturbation is normal. Now, it's like driving a car, When you're driving a car, if you overspeed it or if you take a wrong direction by overtaking, you are doing something wrong. So even masturbation has to have a certain discipline. Now, what these youngsters do, Sanjay, is they masturbate before they've had sex, before they got married, and they watch porn. Okay. They watch porn and they get aroused. Means they are getting erections on watching the erotic images. And we all know that the porn is fabricated, is totally edited stuff. It's not a reality. It's dehumanizing a woman or whatever you call it. There are a lot of wrong things which are happening in the movies. Of course, porn movies. So he watches porn. He masturbates. Then he feels good. His dopamine and all that rises. So then again, after some time, he feels sad. Again, he masturbates. So this becomes his habit. In fact, he's having sex with the videos and images. Okay. Then at times he gets bored, he gets fed up with that type of porn. He watches more aggressive porn, which gives him arousal. normal porn doesn't give him any erections, but he gets more aroused and more, watching multiple partners and having sex at any place with anybody, all those things. Then he gets aroused, he gets erections. Now, this guy, when he gets married, see, he's anatomically absolutely normal. He doesn't have diabetes, high blood pressure, cholesterol, nothing. He's not a smoker, he's not an alcoholic. But when he gets married, that same scenario is not there in his bedroom, which he had when he was watching porn. So he doesn't get erections. So this complain, Doc, he did not perform at the wedding night. He did not perform at the honeymoon. He is not a marriageable material. Divorce. Within 2 months, they go in for divorce. So this is porn induced. So these sort of masturbations are, I call it, dangerous. This can lead them to many wrong things in their life, which will affect their marital harmony, whatever you call it. So masturbation is like driving. You should have a discipline in that.
Discipline. The path of moderation will work for masturbation as well. Not too much, not too little. If you think that it is impacting your personal life or maybe your professional life, let us say you're on duty, maybe you're an air traffic controller, you're on duty, and you get the urge to leave your job and go for masturbation. Now, that is a disease. But if it's not impinging your personal or your professional life, it's fine within discipline.
And second thing, you should not masturbate on the terrace, let people watch, like exhibiting and all that. You should not torture yourself, all those things. So you should not.
So that means it should not impact your personal, professional life, and also not your social life. You shouldn't get into trouble with the
It should
law.
not harm you also.
Yeah.
See, if you're masturbating in a different all wrong ways, that's going to harm you in later life.
So within limits, and actually there are studies to show that more frequent ejaculation prevents cancer prostate. So
absolutely. So that's why it is beneficial. That's why it's beneficial. I was going to come to that. It's normal, it's healthy, and it's beneficial.
And it's also an exercise which keeps your vessels healthy. It will help the endothelium become healthy. And
absolutely.
That endothelium will actually suggest to the endothelium of the brain, of the heart, of the kidneys. You will have less chances of heart attack, brain attack, kidney attack. And it's all part and parcel. Again, I'd like to repeat, it's not linear. It's a cobweb that occurs together.
Correct.
Sir, speaking of cobweb, there are some patients who say, sir, I don't want any tablet. I'd like a local preparation, something that I can apply on the sexual organ to help me maybe gain confidence. I need some hand holding, or maybe increase the size, or to increase my enjoyment. So any medicines, any local preparations that we can use?
As I explained in the earlier part, length does not matter here. So first of all, counsel him to make him realize that whatever length he has, even if you examine if his penis is around 3 inches or 4, tell him that your penis in a non-erect state is 4 inches. So in an erect state, it's going to be at least 5, 6. So is it normal or no? He says yes, it's so that length part of is gone out of his head. Now, there are certain ways where you can increase the duration of your sustenance of erections. There are beautiful gels available, which you can take it for getting better erections, like Himcolin gel of Himalaya. Fantastic, available today. We have now Papaverin gel also available. We have glyceryl trinitrate gels available. We have Eroxon, which is available. So many now things have come, but amongst all, I find Himcolin gel to be much safer, evidence-based, and beautiful, and one can be assured of not having any side effects.
So it will help, and many times we use these for like for hacking in a figurative sense. It gives you a sense of confidence, and
absolutely.
You can use it
Yes.
whenever you feel, and especially for the younger men who are listening to us, this is something that will help you. Even for the ones who are not so young, it helps for dilatation, so it will increase the blood flow to the penis.
Correct.
More blood will reach.
And the ingredients, if you look at the ingredients of it, they are amazing. Since time immemorial, we have been using these ingredients of this product as a longevity product. These are all antioxidants, they are all vasodilators, they are all mood elevators. Every ingredient in these product has got benefits, and now now there are enough studies to prove this. Enough studies to prove this. Maybe not we Indians have not studied all this, but Americans have studied it in their labs, and they found out. And we have got studies on PubMed on all these things, that these are beneficial in normal sexual relationships.
Yeah, the people talk of plagiarism, but actually the main plagiarism is that of Indian wisdom, traditional Indian or Ayurvedic wisdom, which is being marketed and commercial marketed and profiteered by people in the West. It's not their fault also, it's our fault that we've not been able to patent and use our medications, our wisdom properly. The fault is ours. Mohammad Shafi Ansari ji agrees with you, sir. And a point raised by you and enthusiastic is, कि sir, हम तो foreplay में लग गए. Only 5 minutes left for our talk show. We have talked about each and everything under the sun. We have managed to reach erectile disorder, and we have talked about drugs like Tentex Fort for desire, Himcolin ointment for erectile strength. But what about premature ejaculation? Do we have any safe drug for ejaculatory disorders?
Let me. This is my favorite topic. See, early ejaculation is not a disease. It's a psycho-behavioral problem. Why I call it not a disease is because, say, if you are having sex and if you're sustaining for 10 minutes, okay, in the end you ejaculate, okay. Now, when you are having an early ejaculation, say you ejaculate within 60 seconds, so ultimately you ejaculate. So in both the situations, your sex act is complete. Here it's little early. If I teach you an exercise which will increase the duration of your erection, you are fine with it. You don't need any drug. Why it's not a disease? Because there are no tests for it. There are no radiological tests, there are no immunological tests, there are no blood tests, there are no screening, nothing. It's only when you feel it or your partner complains about it that you ask for it. Third thing, this is, trust me, the most common issue with every man on this earth, sometime or the other in his life. It's more common than common cold. Youngsters who masturbate when they were young in their hostels, in the bathrooms, with the fear that somebody would knock. So they do that in a hurried manner. They feel that they are doing some sin or crime or robbing something or anything.
No, and there are people knocking on the bathroom doors, sir, actually, in the hostel.
So this goes into their life as this. The three common things could be some irritation in the urethra, maybe because of prostatic infection, that can give rise to this. And maybe the most important cause is performance anxiety. When a man is having sex, he looks at his penis. He should realize that sex is not between the two legs, it's here. He has to bombard sex center with erotic thoughts, which will send signals and increase the blood flow in the penis. He should not look at his penis. He becomes a spectator. He is a performer, not a spectator. He should focus only on the partners, and get excited. Should look at her breast, look at her thighs, look at her hair, look at her excitement, and bombard his sex center with all the erotic thoughts, which will increase the blood flow. So instead of that, he should do this. So performance anxiety is another common reason. Is sometimes some people have a very hypersensitive glans penis, the tip of the penis. So we have a lot of now numbing creams available or sprays available which can numb that portion. But one caution I would advise us to when they use this numbing creams, some youngsters are into oral sex. So when you apply this numbing cream or a spray, the partner's oral thing also gets numb. So that gives a, she that all my sensations have gone and all. So they should be cautious about these things. There are beautiful treatments available. We have got exercises, we have got medications also available for this. But I normally counsel them, teach certain exercises with which they can feel better.
So basically, it's something that you can relax with, and also we have drugs which you can use to help in improving the strength and the timing.
Yes, and second thing, person who has got erectile dysfunction, and when he's getting erection, he wants to do it fast. So that leads to it. So we should treat his ED first. Should correct his ED, and we can give them very safely Confido of Himalaya. Beautiful drug, beautiful. I can't give him Depoxitin, which is an SSRI, which is an antidepressant, which might give him some other issues. There are certain medications which can be given for a longer, but these are all psychiatric drugs. They all come with a bag of side effects. Maybe dry mouth, maybe constipations, maybe so many things. So if you give them Confido, that works very well with patients.
Thank you, sir. We get confidence from having listened to you. Deep Biswasji thanks you. Akshay asked a question. Akshay, actually, obesity is the commonest problem of a perceived reduction in penis size. And if you reduce your weight and if you shave properly, you will actually find that you will be able to real size. Samir Khan asks,
Actually, in these obese patients, Sanjay, what happens is they see if the penile length is around 4 inches, and if he's got a big suprapubic fat, he will see his penis only 2 inches. So the penis is actually buried, So we call it buried penis syndrome. So many patients who had these issues got the liposuction done around this, and they felt very good about it. Or we can teach them exercises like crouches, etc., and they can reduce this fat.
So we just reduce the belly fat, Akshay, and work on it again. Yeah. Samir Khan asks if there is a bump or sore in the area, please show a doctor. It can be an infection, it can be a hernia, but you must. रेखा जी, today's program is special. डॉक्टर जुमानी का टाइम नहीं मिलता हमें, आज बहुत मुश्किल से मिला है, और आपको अभी ऑलरेडी पता चल गया होगा, he is one of the best teachers you can have on this product. Ayush asks about hygiene products. So as required, again, follow the law of moderation. Don't touch the mucous membrane. Water would be the best way to cleanse the mucous membrane. Aditya Pannu says his birthday is coming up. So happy birthday, Aditya. So, sir, we've had a great 1 hour with you. Last comment before we wind up. Any message? I have a topic of men's intimate health. Enthusiastic asks, what is the right time in a man's age to begin focusing on intimate health?
According to Rishi Vatsayana, he says sex is to be used and not abused. It's not a secret. Even schoolgoers and boys know about what is sex. It is sacred. It's a sacred song of your soul. It's God made. And anything what is God made, it's not bad. Okay. We need to understand that sex is a part of our way of life. Studies show that if you are having sexual intercourse at least twice in a week, there is less incidences of myocardial infarction in them, less incidences of cancer of prostate, more confidence, more self-esteem, more wellness in them. So sex is a very, very important part of our quality of life.
On this, I think that would be a perfect note to conclude this. Sexual health is important, and we look forward, sir, to having you again with us on future talk shows. More and more questions. Faraz is with us backstage. So, Faraz, could you please show a certificate of appreciation for Jumani as we conclude? Thank you so much, Dr. Jumani, for your expertise, your time. Thank you, sir. Thank you, everyone, for being with us on KK Med Talks, and we look forward to meeting you again. More and more discussion on intimate health, men's health, and like Dr. KK Arwal sir used to say, the show will go on and health will keep on improving. Jai Hind, sir.
Jai Hind.